Hi everyone. In today's video, we will see important questions from compliance and regulatory. In the CPC exam, out of 100 questions, they will ask 3 questions from compliance and regulatory section. Let's start with the first question. Who would not be considered a covered entity under HIPAA? The full form of HIPAA is Health Insurance Portability and Accountability Act. Option A, doctors. Option B, HMOs. Option C, clearing houses. Option D, patients. And the right answer is option D, patients. Under the Health Insurance Portability and Accountability Act, covered entities include healthcare providers like doctors and health plans and healthcare clearing houses. These entities are responsible for protecting the privacy and security of patient information. Patients themselves are not classified as covered entities. Next question. Which of the following choices is not a benefit of an active compliance plan? Eliminates risk of an audit, fewer billing mistakes, increases accuracy of provider documentation, faster, more accurate payment of claims. The correct answer for this question is option A, eliminates the risk of an audit. An active compliance plan provides several benefits including fewer billing mistakes, increased accuracy of provider documentation and faster, more accurate payment of claim. It does not eliminate risk of an audit. Regular audits may still occur to ensure that compliance standards are being met. Next question. What is PHI? The full form of PHI is Protected Health Information. Next question. The Medicare program is made up of several parts. Which part covers provider fees without the use of a private insurer? The correct answer is option A, Part B. Medicare Part B covers provider fees for medical services such as doctor's visits, outpatient care and other medical services without the use of a private insurer. Next question. When coding an operative report, what action would not be recommended? The correct answer is option C, coding from the header without reading the body of the report. When coding an operative report, it is very essential to read the entire body of the report, not just the header, to ensure accurate and correct coding, because the header may not contain all the necessary details about the procedures performed. Therefore, we need to read the entire report. Next question. What does MAC stand for? And the right answer is option B, Medicare Administrative Contractor. Next question. What form is used to submit a provider's charge to the insurance carrier? Option A, UB04, option B, CMS 1500, option C, Provider Reimbursement Form, option D, ABN. The correct answer is option B, CMS 1500. The CMS 1500 form is the standard claim form used by healthcare providers to submit charges to insurance carriers for reimbursement. It is primarily used for billing outpatient and office services. Next question. What is not a common reason Medicare may deny a procedure or service? Whether it is patient's condition, frequently proposed, covered service or experimental. The correct answer is option C, covered service. Medicare does not deny procedures or services that are covered under its guidelines. Common reasons for denial can include the patient's condition, not meeting specific criteria, procedure or service being experimental, or the service being frequently proposed but not medically necessary. Next question. What describes whether specific medical item, services, treatment, procedures or technologies are considered medically necessary under Medicare? The correct answer is option A, National Coverage Determinations Manual. National Coverage Determinations Manual provides guidance on whether specific medical items, services, treatments, procedures, or technologies are considered medically necessary and are therefore covered under Medicare. Next question. Evaluation and management services are often provided in a standard format such as SOAP notes. What does the acronym SOAP stand for? The correct answer is option C. SOAP acronym stands for Subjective Objective Assessment Plan. Each component of this acronym represents a different aspect of the patient's information. The term subjective represents patient's reported symptoms and history. Objective represents the healthcare provider's observations and findings during the examination. Assessment represents the healthcare provider's diagnosis or analysis of the patient's condition, and the term plan represents proposed treatment plan including tests, procedures, and follow-up care. So that's it for today. If you need compliance notes and more practice questions, check the playlist CPC Compliance and Regulatory on my channel. The link will also be mentioned in the description.